Today we will do the brachial plexus. So brachial plexus is the plexus formed for the innervation of the muscles of the upper limb, and this brachial plexus start from the C5 to D1. Sometimes C4 is also contributing and sometimes D2 is also contributing. When C4 is contributing, it is called the prefixed, and when D2 is also forming the brachial plexus, it is called the post-fixed type of the brachial plexus. Now before we go into the formation of the brachial plexus, one should know how it is present and comes into the upper limb. As we know, this is the neck region, then start the shoulder joint, the upper limb, and here lies the thorax. So upper limb lies in the junction of the neck and the thorax. And in the center here, in the thorax, there lies the breastbone, that is called the sternum. And below the sternum, the parts, the manubrium, the body, and the below is the xiphoid process. Now, with the manubrium sterni, there are two articular facets. One is for the collarbone, that is called the clavicle. So clavicle is a special bone. The special feature is that this is the bone which starts first of all the ossification and the last to complete. Then it has got no medullary cavity. Then it is subcutaneously throughout. The fourth bone is the long bone lying horizontally in the body. And its development is intramembranous. So they are the 5 features of the clavicle. Then to the same manubrium sterni, there is also the articulation of the first rib. So the costal cartilage of the first rib lies here, along with the clavicle, both the upper lateral part of the manubrium sterni. And the first rib is present like the outer border, the inner border with the scalene tubercle, and on the superior surface of the clavicle there is a 2 grooves. One is in front of the scalene tubercle and other is the behind the scalene tubercle. The anterior groove is for the subclavian vein and posterior groove is for the subclavian artery. And the scalene tubercle is for the insertion of the scalenus anterior muscle. This is the head of the first rib, which articulates with the first thoracic vertebra, the T1. Then above here lies the C7, C6, C5, C4, C3 and C2 vertebra. So these are the cervical vertebrae also present, with their transfer process having the foramen transversae. So this is the architecture of the bones of the neck and the thorax. Now this is the sternal angle of the Ludwig. There is the articulation of the always second rib. Then next is the articulation of the third costal cartilage. Then the fourth, the fifth, and this is the sixth. And last is the lower end of the body of the sternum is the seventh costal cartilage. So these are the costal cartilages which are shock absorber, and to this the bony ribs are obliquely placed. The fourth one, the fifth one, the sixth, and the seventh. Then the bones of the upper limb. Here lies posteriorly the scapula with the superior border, the medial border, which overlaps the clavic ribs with the suprascapular notch, which is converted into a suprascapular foramen by the suprascapular ligament. Then the superior border comes laterally and ends into the lateral border, lateral end of the scapula, that is called the glenoid cavity. This is the lateral border of the scapula, which goes behind the thoracic part with the inferior angle, superior angle, and the lateral angle. So scapula and this hole is the subscapular fossa, which is facing anterior. Then with the glenoid cavity, there is the articulation of the head of the humerus with the greater tubercle laterally and medial tubercle is medially, and in between the two there is a intertubercular sulcus or the bicipital groove with the lateral lip, medial lip, and the floor for the lodgement of the long head of the bicep brachial. Then is the medial border of the humerus, continue downward into the medial epicondyle and the trochlea for the articulation of the ulna medially. This is the lateral border showing a deltoid tuberosity here. The lateral border continue downward as the lateral epicondyle and a rounded capitulum for the articulation of the head of the radius. So above the trochlea there is a ulnar fossa and above the capitulum there is a radial fossa. So this is how we do the bones of the upper limb, the humerus with the shoulder joint is formed so far. So this is the architecture and the arrangement of the bones of the around the upper limb. Now we have to see the anatomical position of the brachial plexus. As we know, it starts from the C5 spinal nerve. So C5 nerve comes from the above the vertebra in the anterovertebral foramen. Then C6, then C7, then CH, and here is the T1. So remember, there are only 7 cervical vertebra, but the spinal roots, they are 8 in number. So this is how the brachial plexus is coming from the neck, above the thorax, then in the axilla, and then it enters the upper limbs. We can draw the brachial plexus like this. Now the C5 root comes from this intervertebral foramen, then C6, C7, C8 and T1. All these 5 spinal nerves will form the brachial plexus for the motor and sensory supply to the upper limb. Now C5 meet with the C6 to form the upper trunk. This is the upper trunk. Then C8 and T1, they unite to form lower trunk. C7 remains alone. So alone it forms the middle trunk. So first of all, trunks are formed. After the formation of the trunk, then comes the divisions. Every trunk divided into 2 divisions, ventral or anterior, and one is the posterior division. We shade the posterior division to differentiate. Every middle trunk also divided into a posterior trunk and an anterior trunk. The posterior trunk unite together. Similarly, the lower trunk also divided into a posterior trunk and the anterior or the ventral divisions. All the posterior divisions, they all unite posteriorly to form the posterior cord of the brachial plexus. Posterior cord. So first is the trunks. After the trunks come the divisions, and after the divisions come the cords. And the starting point, they are the roots of the brachial. So they are the roots, C5, C6, C7. When they come out of the intervertebral foramen, they are called the roots. So remember, roots, trunk, divisions and cord. So that is the sequence. How to remember? Write DC. DC is always right. So that's how to remember the sequence. Now the upper trunk and middle and lower trunk, they divide into anterior and posterior divisions. All posterior divisions, they unite to form the posterior cord. This is the posterior cord. And remember, the posterior cord is continued as the radial nerve. This is the radial nerve. Radial nerve is formed like this. So, radial nerve, what will be the root value of the radial nerve? Now trace this radial nerve backward. From where the fibers are coming? C5, C6. Then fibers are also coming from C7. Then fibers are also coming from C8 and T1. So its root value is C5 to T1. So that is how we remember the root value. Trace them backward, go into the spinal cord, they will tell. Now after the divisions, now come the cord formation. The anterior division of the upper trunk and a little contribution from the anterior trunk of the anterior division of the seventh or the middle trunk unite to form a nerve. That is called the lateral trunk. This is the lateral trunk is formed. Lateral cord. This was the posterior cord. This is the lateral cord. Then also lateral lower trunk after giving the posterior divisions and the anterior division is continued as the medial cord. So three cords are formed: medial cord, posterior cord and the lateral cord. So this is how the RTDC. So now we are having the three cords in our hand. Whole of the nerves of the muscles of the upper limb will be supplied by the branches of these cords. Lateral cord is lateral, medial cord is medial and posterior position. Now come the after they come branches. Now there are branches from the roots also. So branches from the roots, from the C5, from C6 and C7. A nerve is formed from the root. This is called the long thoracic nerve. Long thoracic nerve, or its other name is nerve of Bell. This is nerve of the Bell, long thoracic nerve. So long is the course, more liability to injure. Then comes the nerve branches of the nerves from the upper trunk. So there are two branches from the upper trunk: suprascapular nerve and nerve to subclavis. This is suprascapular nerve and this is nerve to subclavis. Now this upper part of the upper trunk is a very important spot or the point in the brachial plexus. This area is called the Earth's point, where 6 nerves they are present: 1, 2, 3, 4, 5 and 6. So 6 nerve meeting place is called the Earth's point. Earth's point is very much clinically important. The injury of this point lead to many problems of the muscles, paralysis of the many muscles and disability of the upper limb. So that is the upper. Then the lateral cord will give a lateral root and medial cord will also give a medial root. Both the roots they unite together. Lateral root from lateral cord and medial root from medial cord, they unite to form a nerve which is called median nerve. This is median nerve. And if you trace the root value of the median nerve, go back, where you will reach C5, C6, then C7 fibers are also coming here. Trace it. Where goes it? C8 and D. So again, the root value is like the radial nerve from C5 to D1. So this is how we trace the root values of the nerves. Then the lateral cord will give one more branch. This is called the lateral pectoral nerve. Lateral pectoral nerve. Similarly, the medial cord will also give a branch. This is called medial pectoral nerve. Medial pectoral nerve. Then after giving the lateral root of the median nerve and lateral pectoral nerve, now this lateral cord is continued as musculocutaneous nerve. It is continued as musculo-cutaneous nerve. Similarly, the medial cord, after giving the medial pectoral nerve and medial root of the median nerve, is continued and it is giving two more branches. The proximal is the medial cutaneous nerve of the arm, and this is the medial cutaneous nerve of forearm. So 4 branches are given by the medial cord. 1, 2, 3 and 4. 4 branches of the medial cord you have to remember. Then the posterior cord. So posterior cord is also giving the branches. One branch is called the axillary nerve or circumflex nerve. It also gives 4 branches. The posterior cord. One is the axillary nerve from the upper aspect. Then it gives the upper subscapular and lower subscapular nerve. And one thoracodorsal nerve or nerve to latissimus dorsi. So 4 branches you have to remember by the medial cord, 4 branches from the posterior cord. The axillary nerve, upper subscapular, lower subscapular, and this is the thoracodorsal nerve or nerve to latissimus dorsi. So if you want to trace the root values of the musculocutaneous, go back. Root value will be C5, C6 and C7. Root value of the axillary nerve or circumflex nerve, trace it back. It is the C5, C6 and a little contribution, maybe or may not be from C7. Root values of the upper and lower subscapular and the thoracodorsal nerve, trace them up. They are again C5, C6 and C7. The contribution of the C8 and T1 is minimal, less. So that is how we trace root values of. So after giving the 4 branches, the medial cord is continued as ulnar nerve. The medial nerve of the medialmost nerve of the brachial plexus is the ulnar nerve, and lateralmost nerve of the brachial plexus is musculocutaneous nerve. That you have to remember. And median is in between the two is called median, and radial nerve is the continuation of the posterior cord. And it is posterior in position, so it is posterior also in the posterior in the arm, and also it remains posterior in the forearm also. While the anterior compartment contains musculocutaneous, then median nerve, and medial is the ulnar nerve. So they are supplying the flexor muscle of the anterior aspect. So this is how we draw the brachial plexus with all the roots and root values of the nerves. So now we have to superimpose this brachial plexus and how it is present in our body. What is its relations with the arteries, the nerves and the muscles and nerves. Now here we know there like anteriorly there is a coracoid process of the scapula. And subscapular fossa. And this subscapular fossa give rise to the origin of the muscle that is called the subscapularis, which is inserted on the lesser tubercle. So this muscle is subscapularis. Then from the lateral border of this scapula in the lower part, another muscle is taking origin, supplied by the lower subscapular nerve, coming upward and inserted over the medial lip of the bicipital groove. Medial lip of the bicipital groove, and this muscle is teres major, supplied by lower subscapular nerve, which is near to it. So subscapular muscle is very big, so there are two nerves to supply them. The upper is the upper subscapular and lower is the lower, plus is also supplied by teres major. Now another muscle of the from the thorax inserting into the bones of the upper limb is the pectoralis minor muscle. This pectoralis minor muscle takes origin from the third, fourth and fifth ribs. Third, fourth and fifth rib from its outer border. And this muscle, after taking origin, is inserted over the medial tip of the coracoid process. So this muscle is the pectoralis minor. It is its medial or the superior border, this is the lateral or the inferior border. Pectoralis minor. It will be covered by the big muscle, that is the pectoralis major, which takes origin from the medial half of the clavicle, then from the lateral border of the manubrium and the body of the sternum. This is the origin of pectoralis major muscle. It will cover everything. So the brachial plexus starts from the neck region and it is descending downward obliquely to enter into the upper lip. We know the first rib is there, and we know the relations of the first rib also. So anterior groove in front of the scalene tubercle is called the subclavian vein. This subclavian vein touching the superior surface of the first rib. A groove is already there for in front of the scalene tubercle. Then this scalene tubercle got the insertion of a muscle that is called scalene anterior muscle. So scalenus anterior muscle is inserted over this scalene tubercle. And this muscle is accompanied by the very important nerve always, nerve of the diaphragm, that is the phrenic nerve. And what is the root value of phrenic nerve? C3, C4 and C5. So this also descends with the scalene tubercle, scalenus anterior muscle, the phrenic nerve. And the posterior groove, we know it is for the subclavian artery. So this is the subclavian artery occupying the groove behind it. This is the same subclavian artery we have done in the heart, in the thorax. The arc of the aorta starts from the sternal angle and arc of the aorta ends into the at the sternal level. This is the arc of the aorta. And the arc of the aorta has got three branches: right brachiocephalic, the left common carotid, and one more left subclavian. So right brachiocephalic will divide into right common carotid and right subclavian. And this subscalenus anterior muscle will divide the subclavian artery into first part, second part and third part. from the outer border of the first rib. Now the subclavian artery is now called axillary artery. Axillary artery. And this axillary artery is now has to enter into the upper limb. So this is the only artery which will supply all the muscles of the upper limb. So this is the course of the axillary artery. So it runs obliquely downward and laterally. Then it passes below the clavicle. And now it is coming on near the upper border of the pectoralis minor muscle. Then it goes behind this muscle, tendon of the muscle, and then it appears from its lateral border. Then it will run on the teres major muscle, and now it is in the axilla. So this axillary artery has got three parts. First part starts from the outer border of the first rib up to the medial border of the pectoralis minor. The second part lies behind the medial border and the lateral border of the pectoralis minor. The third part of the axillary artery starts from the lateral border of the pectoralis minor over the lower border of the teres major. So this is how we divide the axillary artery into first part, second part behind the pectoralis minor, and third part and so on. Below the teres major, now this artery is called, its name changes now. Up to here this was axillary artery. Now it is called the brachial artery. Brachial artery. So that is the how it descends from the up and down. Then one more muscle is inserting over the upper outer border of the first rib, taking origin from the third, fourth and fifth vertebra, passing behind the brachial plexus, is called the scalenus medius muscle. Scalenus medius is inserted over here. So in this way, between the scalenus anteriorly and medius behind, so this gap is there. Through this gap is coming the brachial plexus. From the same vertebra from where these muscles they are taking origin. So that is the relation of the muscles with the roots of the brachial plexus. So then the C5 and C6 unite to form the upper trunk. C8 and T1 they unite to form the lower trunk. C7 is continued as upper trunk. Now we have seen that this upper trunk is having a point that is called earth point. Earth point has got two branches. One is the suprascapular nerve and nerve to subclavius. Now the suprascapular nerve, this is the upper trunk. So this nerve will pass through this suprascapular foramen. And the suprascapular nerve will go back side of the scapula and it will supply the two muscles, supraspinalis and infraspinalis. So that is how from the earth point it is going up. And second is the nerve to subclavius. Sub means below, clavius means clavicle. So subclavis is a very small muscle taking origin from the medial end of the bony rib of the first rib and a few fibers from the superior surface of the costal cartilage of the first rib. By a tendinous origin, this muscle runs upward and laterally and it is inserted like a tendon on the inferior middle surface of the clavicle, subclavis. So function of the subclavis is not known. Probably it keeps the clavicle in relation to the first one. So this is the original insertion of the subclavis muscle. So from the same urge point, a nerve to subclavis comes posteriorly and it supplies it. So that is the urge point. It is lying just above the shoulder. So any injury at this point or any stretching of the neck and the shoulder will break this nerve point, and patients suffer from urge paralysis. So that is the urge point, the sixth nerve where medial. Then this lateral cord, so this upper trunk after giving the two branches, anterior division and posterior division. And a cord is formed here, the lateral cord, by the union of C5-CC in the upper trunk and the anterior division of the middle trunk will form the lateral cord. The lateral cord is formed by the contribution of the upper trunk and the middle trunk to form the lateral cord. It lies lateral to the first part of the axillary artery. Then we have also seen that this lateral cord will give a lateral branch, lateral root, and this is the medial lower trunk will give rise to the anterior divisions and the posterior. All the posterior divisions, they unite to form the posterior cord, and posterior cord is lying also lateral to the first part of the axillary artery. The lateral cord, then posterior cord is also lateral. After giving the lower trunk will give rise to the anterior divisions and it will continue as the medial cord. So this is the lower trunk. It has given the anterior branch divisions and it is continued as the medial cord. So this medial cord of the lower trunk will be continued and it lies behind the first part of the axillary artery. So you have to remember the relation of the brachial plexus cords with the first part of the axillary artery. Lateral cord is lateral to the artery. Posterior cord is also lateral to the artery. While the medial cord is posterior to the axillary artery. As they descend to the second part, the lateral cord is lateral, the posterior cord is posterior, and the medial cord, which was posterior, now it becomes medial. So when they come into the third part, lateral cord is lateral, posterior cord is posterior, and medial is medial. So relation of the three cords with the second and third part is the same. Lateral cord is lateral, medial cord is medial, posterior cord is posterior. Only you have to remember the relation of the cords with the first part. The lateral cord is lateral, posterior cord is also lateral, and the medial cord is posterior in position. So that you have to remember. So that is the relationship. Then the lateral cord is now near the axilla. Medial cord is here. So medial cord, while it is behind the pectoralis minor, it gives the first branch, the medial cord, that is the medial pectoral nerve. And this medial pectoral nerve will pierce the pectoralis minor, it will supply it, because it lies just behind. Then it comes up, because upper is the pectoralis major. So after supplying pectoralis minor, the medial pectoral nerve will now enter the deep surface of the pectoralis major and it will supply it. And that is the question. While the lateral cord will give rise to the lateral pectoral nerve. And this lateral pectoral nerve will also supply the under surface of the pectoralis major. So pectoralis major is big, so it has got two nerve supply. One is the medial pectoral nerve and lateral pectoral nerve. Both supply the pectoralis major. But pectoralis minor is a small muscle, so only one nerve is sufficient. That is the medial pectoral nerve, you have to remember, the nerve supply of the intellect. So this is how we see that how the brachial plexus descend from the neck to the shoulder and shoulder to the axilla. So in the axilla, from the lateral root is continued as lateral cord is continued as musculocutaneous nerve. After giving the lateral root of the median nerve, the medial cord also gives a branch, the medial root of the median nerve, and both unite lateral to the artery, and what is this form? Median nerve is formed. So this is the median nerve formation, lateral root from lateral cord, medial root comes from the medial cord, and this is how the median nerve is formed here. So median nerve is lateral to the brachial artery, and at the insertion of the coracobrachialis muscle, the median nerve crosses from medial to lateral to medial side. So median nerve crosses here. First is the lateral, the formation is the lateral to the artery. But at the insertion of the coracobrachialis muscle, the nerve crosses in front of the brachial artery and becomes medial. Then it will remain medial in the cubital fossa artery. Here is the crossing. You have to remember about the median nerve crossing. Then the medial cord, after giving the branches, the medial root, medial pectoral nerve, and one upper subscapular nerve, upper medial brain nerve of the arm, which will supply the skin of the arm. The skin of the arm is supplied by the medial cutaneous nerve of the arm, while the other branch is the medial cutaneous nerve of forearm. So here it will supply the medial cutaneous nerve of the forearm, it will supply the skin of the forearm. Then this medial cord is continued as the ulnar nerve, which passes behind the medial epicondyle. A groove is already there, and then it enters the forearm behind the medial epicondyle as the ulnar nerve. So medial cord is continued as ulnar nerve after giving the four branches. So this is the ulnar nerve, and this is the median nerve in front of the cubital fossa. One of the content, medial-most content of the cubital fossa is the median nerve. So this is how the median nerve is formed, how it is crossing, and how it is coming. So that you have to remember. The posterior cord remains posterior and is as the radial nerve. And this posterior cord will give the two branches. The upper subscapular with the subscapular muscle. The upper subscapular will supply the upper part of the subscapularis muscle. The lower subscapular nerve will come and start the lower part of the subscapularis muscle, plus it also supplies the teres major. The nerve supply of teres major is lower subscapular, upper subscapular is here. Then the third branch of the posterior cord, which is posterior to the axillary artery, in the axilla gives the nerve to latissimus dorsi or thoracodorsal nerve. So below the teres major, there is another muscle is coming from the back side, the latissimus dorsi, to be inserted over the floor of the bicipital groove. This muscle, large muscle, is coming from the backside, from the thoracolumbar fascia, from the spines of the lumbar and thoracic vertebrae, is latissimus dorsi. So this latissimus dorsi is getting the nerve supply from the axilla by the posterior cord. The middle one is the thoracodorsal nerve. We supply the latissimus dorsi muscle. So this is how we finish with the branches of all the lateral, posterior and the medial cord, and how these three nerves are there in our hand: median nerve, ulnar nerve, median nerve, and one is the musculocutaneous. The lateralmost is the musculocutaneous nerve. Musculocutaneous nerve is the musculocutaneous. It supplies the muscles that the biceps, coracobrachialis, and medial head of the brachialis muscle. After supplying these muscles, the bicep muscle, the coracobrachialis muscle, and the medial half of the brachialis muscle, now this nerve is continued laterally below the skin and enters the forearm to supply the skin of the lateral part of the forearm. This is called lateral cutaneous nerve of the arm, of the forearm. That's why it's called musculocutaneous. Then the posterior cord is continued after giving the upper subscapular, lower subscapular and thoracodorsal nerve, and the lateral, and now it is posterior to the axillary artery, and posterior to the axillary artery at the insertion of the coracobrachialis. This posterior cord will be continued as the radial nerve, and we know behind the posterior part of the shaft of the humerus there is a radial groove or a spiral groove. So at the level of the insertion of the coracobrachialis, this posterior cord will be continued as the radial nerve in the radial groove or the spiral groove, and it appears on the lateral part of the shaft of the humerus and is continued downward in front of the lateral condyle and epicondyle of the humerus in the cubital fossa. It is in front like the medial nerve. So this is the radial nerve comes, how it comes from the posterior aspect of the radial groove. Then this is the skin. Below the skin is the superficial fascia, that is the yellow color fat. And below the superficial fascia there lies the fascia, that is the deep fascia. So deep fascia in the arch and the lateral border of the humerus is connected by a septum, that is called the lateral intermuscular septum. We divide the muscles of the humerus into the anterior compartment and the posterior compartment. So this is the lateral intermuscular septum. So this radial nerve lies in front of this lateral intermuscular septum. Medially, from the medial border of the humerus, another septum goes, which get attached to the deep fascia of the arm. This is called the medial intermuscular septum. And ulnar nerve lies behind the septum. You have to remember, ulnar nerve lies behind the septum, while the radial nerve lies in front of the septum. So that is how we do the brachial plexus and superimpose it with the body, that picture give you that how this and where lies the iris point, and rest of the applied will continue